I've started speaking things into existence, and I think it's working. My body is T. My credit score is over 400. CEO of United Health Group, Brian Thompson, is dead. To do with my credit score. CBS News, December 10, 2024 confirms. My body is indeed T. Also, Brian's dead. But it shouldn't be surprising. According to NBC Chicago, January 7, 2025, United Healthcare, alongside the 5 other largest health insurers, deny up to 1 in 3 health insurance claims. Consumers who have their claims denied often don't know what their health insurance covers, what they need to pay out of pocket, or what's behind the yellow wallpaper. AJMC, August 5, 2024 furthers. When consumers are denied coverage and appeal, they're overwhelmingly successful. Considering ProPublica, August 31st, 2024 points out, insurance companies deny claims, delay spending, and whatever the hell depose means. It's time we understand a system that was designed to exploit us. Let's address the causes, effects, and solutions to our health insurance system. Because even Brian Thompson's claim got denied. Just like I said it would. Luigi Mangione, the person, not the pasta, charged with killing Brian, is, according to BBC, December 24, 2024, Italian. Now, I've watched a lot of documentaries on Italian godfathers, and shooting someone is actually a sign of respect in their country. Causes of insurance trouble, not cultural differences. First, mass denials. According to PBS News, May 28, 2023, insurance giants like Cigna can automatically deny up to 50 claims every 10 seconds. The only thing you can do decently in 10 seconds is most guys at an SEC school. ProPublica, April 29, 2024 adds, doctors processing complex claims for life-saving drugs or surgeries are allowed no more than 4 minutes per claim. When speed is a priority, errors are more likely. Turns out you can't just bake cookies at 3,500 degrees for 1 minute. ProPublica continues, errors as small as a misspelled name can lead to an automatic denial, putting the burden of correction onto the patient, costing time, energy, and money. So, I guess Sophia is fucking dead now. Next, appealing denials is hard. New York Mag, July 17, 2024 explains, there are so many different kinds of health insurance. Public and private, employer-sponsored and not, fully funded and self-funded, sex and the city. This means there's no standard appeals process, leaving patients to figure it out themselves. I've never figured out anything for myself. I figured it out for her! My speech. A 2023 KFF study found 60% of Americans didn't even know they could appeal their medical bills. I heard they had insurance explained to them by a puppet. Hey! The aforementioned ProPublica article's author tried to create a guide to appeals. She spoke with over 50 insurance experts, lawyers, patients, physicians, and consumer advocates, who all said it was a great idea, but nearly impossible to do. You know what else they said was impossible? The burger I had for lunch. That shit was meat. This is the 4th time something I wrote in a speech became real. It's like Death Note, but the entire time, my body is tea. I've never seen Death Note, but I saw a duo of it once. Much like that guy in Death Note, insurers have disastrous effects. First, after denying you on the front end, insurers surprise you on the back end. It's 2 in the pink, 1 in the stink. The stink is crippling debt. Public Interest Research Group, January 10, 2025 explains, bills caused by errors or improper claim denials can still show up on your credit report as unpaid medical debt even as you work to fix them. Once medical debt affects your credit score, you're less likely to get loans, jobs, and housing, despite it not being an indicator of creditworthiness. A much better indicator is how much raw milk you drink. Bloomberg, January 9, 2025 points out, a new Consumer Financial Protection Bureau rule will prevent medical debt from affecting your credit score. So it's fixed! Well, according to NPR, February 7, 2025, there's not going to be a Consumer Financial Protection Bureau, you stupid slut! Insurers are winning this game because they wrote the rules. Next. People are dying, Kim. Brian Thompson was an innocent man doing his job who didn't deserve to be murdered. Nah, I'm just kidding. Actual innocent people are dying. Dr. Cheryl Kunis shares on January 26, 2025, she had a patient with a tumor and needed a PET scan to determine the tumor spread. After her patient's initial claim was denied, his appeal was approved 6 months later. By that time, he was already dead. Harvard Public Health, April 16, 2024 adds, over 60,000 Americans die each year because they can't get the care they need when they need it. Sometimes they don't get the care they need until after they need it. From an necrophiliac. Either way, insurers prioritize profit over personhood, and we pay the price. Luigi Mangione is just one of millions suffering under a system perpetuated by CEOs like Brian Thompson. But his actions have shifted the national conversation. We can fight back. A better world is possible. A better system is possible. That's why I've got a gun. Violence is never the solution. At least, that's what my coach told me to say. So, I came up with 2 other ones. First, paying your medical bills. Don't. At least not right away. Experian, March 31st, 2024 explains, start by looking for billing errors or opportunities to appeal. Next, negotiate with your hospital or doctor to lower the price. Negotiate by taking hostages. Good idea. National Consumer Law Center warns, do not pay your medical debt with a credit card. You will be charged interest and late fees you wouldn't pay otherwise. If your medical debt is less than $500 or under a year old, it won't affect your credit score. So take your time paying it off. My anonymous teammate is still paying off their Turkish hair transplant. In my resources, you'll find more information on your rights as a consumer. Finally, appealing your denials. The aforementioned ProPublica continues. Only 1 in 500 denials get appealed, but those that do have a 60% success rate the second time around. It's like when you see the same guy like you on Hinge, Tinder, and Bumble. Might as well. These steps are hard to understand, which is why we've put them into speech terms for you. If your judge gives you a 6 on your ballot, read the ballot, denial letter, to figure out why. Next, talk to your coach, insurance company, to clarify the problem. Now it's time to edit your piece. Gather new lit, doctor's notes, prescriptions, referrals, and create your new draft. Appeal. Now it's time to compete and get feedback from the circuit. Your insurance company. I've laid out these steps in my resources, plus organizations that can help with your appeal. It's not going to be easy, but it's worth a shot. And another. And another. After looking at the causes, effects, and solutions to our broken health insurance system, it's clear that it's time for insurance companies to pay up instead of us.